You're on the record.
We're on the record. Good morning. Today is Tuesday, November 2nd, and the time is 9 o'clock. The board's in session to conduct its weekly open business meeting. All three commissioners are present. Also with us, I'm going to start around. Introduce yourself for the record.
Deborah Phillips with Ada County Operations.
Mike Work, Operations.
Denise Otter, Assessor's Office.
Sean Rain, paramedic.
Cameo Aikens, paramedic.
Tony Geddes, your public defender.
Bob Perkins, Ada County Procurement.
Richard Beck, Development Services.
Elizabeth Duncan, Communications.
IT guy.
Beth Mon, Treasurer.
Thank you. Thank you. We have on the bridge with us, we have Bethany Calley and Steve Rutherford. Okay, Madam Clerk, are there changes to the agenda?
No, they're not.
We have some unfinished business. May I have a motion to remove the unfinished business from the table?
Yes, Mr. Chair, I move to remove the unfinished business from the table for consideration.
Is there a second to the motion?
Second.
It's been moved and seconded. All in favor say aye. Aye.
Aye.
Aye.
We have before us two agreements. First agreement is agreement number 13514-2-21, agreement between Ada County and Barnum Law for public defense outside counsel for conflict clients. Do we have any discussion or motion on this agreement?
Mr. Chair, I'll go ahead and move to approve agreement 13514-2-21 as identified on the agenda.
Okay, do we have a second to the motion?
Second.
Okay, it's been moved and seconded. All in favor say aye. Aye.
Aye.
Okay, we have agreement number 14461, professional service agreement between Ada County and Westburg and Associates, tabled from 10/26 to today. Is there a discussion?
Yes, Mr. Chair, I'd like to speak to this one.
Can we wait to see if we have a motion?
Yes, Mr. Chair, I'll go ahead and move to approve the agreement number 14461 as identified on the agenda.
All right, do we have a second to the motion?
Second.
It's been moved and seconded to approve agreement number 14461. Discussion.
Mr. Chair, I will
Yes.
be voting no on this contract because I believe that fundamentally government should not be in the business of using tax dollars to hire private lobbyists to lobby the legislature. While the intent may be good, we only have to look around the country to larger states to see that this practice is out of control and regularly used to increase the size of government, rarely to limit it. Idaho is still a small state with conservative values, and I'd like to keep it that way. If we renew this contract, it will become the new norm for Ada County to engage in this practice. Subsequent commissions will continue to automatically renew lobbying contracts because this is just the way we do business now. Paid county lobbying will be akin to a new government program, which Ronald Reagan said is the one thing that will never die. Our behavior will send signals to other county and city governments who will no doubt want a piece of the action. Soon there will be a new army of taxpayer-funded lobbyists at the Capitol, further reducing the citizen's voice as we become more and more like the large states we constantly say we don't want to become. And while this board may have some good ideas for the legislature, subsequent boards may have radically different ideas. We'll be handing them a powerful tool to potentially undo everything we've accomplished. It's illegal in Idaho for governments to spend taxpayer money to advocate for a specific side in elections. Taxpayer-funded lobbying should be looked at in the same light. The state of Texas has been working for the last few years to ban this practice. The state of Arizona now bans taxpayer-funded lobbying by state agencies. This is not a road I believe we should be going down. So that's the moral argument against the issue, but let's look at the practical argument as well. Do we even really need a private lobbyist? Our office is a few short blocks from the Capitol. There is nothing to stop any commissioner from walking to the Capitol to meet with legislators, and indeed, we all did this last session. All three of us have extensive contacts in that building. I am on good terms with dozens of legislators from around the state, including several in leadership, as are my fellow commissioners. We have staff in this office who are well-versed on county issues, who can communicate with legislators. We have attorneys on the other side of the hall, whose entire careers revolve around county law, we're willing to communicate the board's agenda to the legislature. And I don't believe that we have even done our due diligence to meet with our Treasure Valley legislators to get their sense of whether our issues even need a lobbyist. One of the issues specified in the contract is to advocate for a tax on vapes. Seeing as the vape industry is considered a villain by the mainstream these days, it's unlikely we'll need additional help to impose a tax on them. Now, I did take the liberty of contacting all of our Republican legislators in Ada County to get their opinion on this issue, both as county taxpayers and the target of our lobbying effort. Of those I spoke to, 8 were a hard no. 2 others thought the job could just as easily be accomplished by commissioners instead of a lobbyist. 1 questioned the value of what we'd be getting for what we spent. And finally, 1 was in support. Therefore, Mr. Chair, for all the reasons I've stated, I would encourage this board to vote against this agreement.
Okay, it's further discussion.
Yes, Mr. Chair. I think that we have Idaho Association of Counties that does a great job representing us over at the legislature, but as you know, Ada County from time to time has very different issues than the rural communities, and they cannot represent us adequately. And we have some pretty big items and issues that come before the legislature that need professional help, that we are not, if we're doing our jobs over here, running a $300 million business, we're not spending all of our time over at the Capitol, nor should we have time to do that. We've had help with impact fees, including the ambulance district, which has been very, very helpful for our EMS. We had help with the ERAP funding, which was really helpful in keeping it here and separate from the authority, the Idaho Authority. We've had help with, we're going to need help this year, a lot of help this year with the state wanting, or some of the rural communities wanting to put the public defender's office under the state. And we don't think that's a good idea, and that's going to take a very concerted effort and, again, professionals. So I'm going to vote for this.
Okay. Any further discussion?
Yes, Mr. Chair. I don't question the fact that we would get value for our money. If you're paying $80,000, you better be getting some value. To me, it's really the method by which we're accomplishing or attempting to accomplish our goals that I have an issue with. And so I think for me, this is an ends don't justify the means type of issue.
Okay. I will be voting yes on this agreement simply because I do think we need professional representation. What we have here is a full-time job, and we don't have enough time to be spending over at the Capitol, and there's lots of other issues in addition to the legislation that a full-time lobbyist or a lobbyist working for us will be able to benefit the county and the county taxpayers. I doubt if any of the legislators that you talk to would object to our reducing taxes by $21 million this year. So with that, I'll call for a vote. I'm going to ask for a roll call vote.
Commissioner Kenyon?
Aye.
Commissioner Davidson?
Nay.
Commissioner Beck?
Aye.
And the ayes have it.
Ayes have it, thank you. We have some public hearings. 3 resolutions. I'll open a public hearing on resolution number 2683. Resolution for destruction of miscellaneous files, employee applications and financial records. Is there discussion? Is there anyone wish to offer testimony on this public hearing? If not, I'll close the public hearing. Do I have a motion?
Yes, Mr. Chair, I move to approve the resolution 2683 as listed on the agenda.
Is there a second to the motion?
Second.
Been moved and seconded to approve resolution number 2683. All in favor say aye. Aye.
Aye.
Aye.
Motion carries. I'll now open a public hearing on resolution 2684, resolution regarding revised qualifications-based selection guidelines for design professional on projects under 50,000. Is there anyone wishing to offer testimony in this public hearing on resolution 2684?
Bob?
Yes, Mr. Chairman, Commissioners, previously the board had adopted separate resolutions to address its guidelines for selecting design professionals like architects and engineers. in relation to Idaho Code 672320. With those guidelines now being included in your procurement manual, the use of a separate resolution is unnecessary. So what this resolution does is it repeals those prior resolutions and makes it clear that the procurement manual is where we will find the information for how we select design professionals.
Thank
So it's a
you.
one-stop shop now.
Okay,
Thank you for simplifying that
Yes.
process.
simplifying. All right, good. Is there anyone else that needs to, that would like to offer testimony on this resolution? Hearing none, I'll close the public hearing on resolution 2684. Is there discussion amongst the board?
No, Mr. Chair, I'll go ahead and make the motion if we're ready.
We're ready. I'll entertain a motion.
Okay, I move to approve resolution 2684 is listed on the agenda.
Second.
It's been moved and seconded to approve resolution 2684. All those in favor say aye. Aye.
Aye.
Aye.
Motion carries. I'll now open the public hearing on resolution 2685, resolution to auction large rolling filing unit.
This is yours, Tony.
Mine, Mr. Chair, Commissioners, this is my large rolling cabinets. I've got like 8 of them. They were full of files. We've gotten those files all out to storage or destroyed as appropriate. And now we've gone entirely digital, so we need to get rid of them. It will open up some valuable space for cubicles, interns, legal assistants, that sort of thing.
Thank you. Are there anyone else that wishes to offer testimony on resolution 2685? If not, I'll close the public hearing on resolution 2685. What's the pleasure of the board?
Yes, Mr. Chair, move to approve resolution 2685 is listed on the agenda.
Second.
You've heard the motion. All in favor say aye. Aye.
Aye.
Aye.
Motion carries. Thank you. We have now, next up on the agenda, licenses and, licenses. May I have a motion on licenses?
Yes, Mr. Chair, move to approve the licenses as listed on the agenda, including 5 catering permits and 1 new license, and authorize the chair to sign the documents on behalf of the board.
Second.
It's been moved and seconded. You've heard the motion. All in favor say aye. Aye.
Aye.
Aye.
Motion carries. Do we have anyone here from the clerk's office? I know he's busy with an election. Today is an election.
Happy Election Day, everyone.
Happy election day. Yes. I guess no one's here from the clerk's office to give us a report. So we'll move on. I'll entertain a motion on the claims journal.
Yes, Mr. Chair, move to authorize payment of claims on the Claims Journal dated October 29th, 2021.
Second.
It's been moved and seconded to approve the claims journal. All in favor say aye. Aye.
Aye.
Aye.
Next are personnel actions. Do I have a motion?
Yes, Mr. Chair, I move to approve the personal actions as listed on the agenda and that the summary sheet remain on file in the Commissioner's office.
Second.
It's been moved and seconded. All in favor say aye. Aye.
Aye.
Aye.
Motion carries. Do we have anyone here from the assessor's office?
Mr. Chair, we have.
Oh, yeah,
Denise.
there you go. Excuse me.
No worries.
Do you have a report for us?
We don't have anything to report. Bob had a scheduling conflict, so that's why I'm here today.
Sure, all right. Well, thank you for being here. Okay, we do have some tax cancellations, which are not really cancellations, they're changes, but that's what the statutes call them. I have a number of them.
Yes, we do.
We have 97 tax cancellation and adjustments on the agenda. I'll entertain a motion.
Yes, Mr. Chair, I move to approve the tax cancellations as listed on the agenda, which include 1 tax cancellation for 2019, 1 tax cancellation for 2020, and 95 tax cancellations for 2021, and authorize the chair to sign the documents on behalf of the board.
Second.
It's been moved and seconded. All those in favor, say aye. Aye.
Aye.
Aye.
Motion carries. We have with us our distinguished treasurer.
Good morning.
Good morning.
Morning, Beth.
You have good news for us?
Yes.
Good.
Well, I'm happy to report that we've received the final PTR property tax reduction valuation that's going to be paid by the state. And that's good news because that's the final piece of the puzzle that our office needed in terms to prepare us for generating the tax bills. So our priority this week will be processing these tax cancellations, which you've just approved. Thank you and your staff for sending these to us so quickly. We will need to approve all of these by Friday. Then we are essentially freezing our data while we start generating the 2021 tax bills. So any tax cancellations after today will be a post-tax bill adjustment. So these that you've just approved today and all previously will be reflected. It'll be a line item on the tax bill where the taxpayer can see the reduced tax amount. But anyone after this, it will be just, we will send an adjustment, a revised tax liability based on the adjustment. So that'll be our priority. These bills will be mailed by November 22nd. So it'll take us about the next 10 to 14 days to balance them and review all the proofs. And then they'll start hitting mailboxes right around Thanksgiving.
Perfect timing.
Okay. Any other discussion from, or questions of our treasurer? So when we get the additional tax cancellations, because thanks to the legislation that was passed a year ago, we'll get them clear up until the end of the year.
That's great.
But we'll have to send out adjustments to the people that we're adjusting?
That is correct, Mr. Chairman, because at that point, the taxpayer will have received a bill that does not reflect the
Right.
adjustment. So we will process that internally, then notify the taxpayer of the reduced new amount.
Right, so there's gonna be some adjustments to be made in certain budgets, because it'll be a smaller amount. Okay,
Right.
well, great. Well, sounds like you got your work cut out for you the next few weeks. Got good mailing services, I'm sure.
Yes.
All right, well, thank you, Beth,
Thank you.
appreciate
Thanks,
that, yeah.
Beth.
All right, we have development services with two final plats. First is the application number 202000342S, Pure Country Estates. Is there any discussion?
Mr. Chair, Richard's here. Do you want to give us any
Sure, Richard?
information or
Yeah.
brief overview?
Mr. Chair, members of the board, for both of these development services items today, staff has reviewed the applicable conditions of approval for these final plats, find that they've all been satisfied and that both plats comply with Ada County Code and State Code, and recommend that the board recommend the chair sign the plat on behalf of the board.
Thank you.
Okay. Do we have a motion?
Yes, Mr. Chair, I think we need to take these up separately, so I'll go ahead with the first one and move to approve application number 202000342, South Pure County Estates Number 2, and authorize the chair to sign and stamp the final plat on behalf of the board.
I'll second that.
Thank you. All in favor of the motion, say aye. Aye.
Aye.
Aye?
Aye. Now we'll take up application 201900831-S.
Mr. Chair, I move to approve application number 201900831S, Heartland Ranch subdivision, and authorize the chair to sign and stamp the final plat on behalf of the board.
I'll second that.
Okay, we already know that the staff has gone through them and they meet the conditions, so, all those in favor say aye.
Aye.
Aye?
Motion carries.
Mr. Chair,
Yes.
I just wanted to thank Richard and his staff. I think the idea of moving some of these administrative items to our OBM instead of piling them up during the public hearing has been very helpful. Those public hearings, the agendas just keep getting longer and longer. And so I think that the public who needs to show up to actually be heard for their hearing probably appreciates these administrative items being taken up in this time.
Yes, Mr. Chairman, if I could add, we appreciate your willingness to entertain these at the open business meetings. It gives these developers who've been waiting a long time for these plats to be processed, a little bit faster opportunity to get them signed. So appreciate that.
Okay. Well, thank you. Appreciate it. Appreciate getting this done faster, and I'm sure the applicants appreciate it as well. Okay, we have a motion on the minutes.
Yes, Mr. Chair, I move to approve the minutes as identified on the agenda and authorize the chair to sign the documents on behalf of the board.
Second.
Okay, it's been moved and seconded to approve the minutes. All in favor say aye. Aye.
Aye.
Aye.
Next, we have a grant. Is there discussion on grant application and memorandum of understanding for the State Homeland Security Grant Program, $568,116. No match. Grant period October 1st, 2021 to April 1st, 2024. Is there any discussion?
Is there anyone here who can speak to that?
Joe's not here.
Excuse me, Commissioners, this is Sue.
Yeah. There she is.
Yeah.
I can answer any questions you may have, but basically, this is one of two grants that we receive annually that keep our office moving forward. And this particular grant, we utilize those funds for training, exercising, equipping, community outreach, and things of that nature.
Okay. Thank you, Sue.
Follow-up question?
You're
Follow-up
welcome.
question.
So, I just wanted to go over some language in the grant here and ask you a question about it. One section says, the Idaho Criminal Intelligence Center will hire an analyst to focus solely on domestic violent extremism. Additionally, funds will allow for the procurement of web crawling software and subscription for services that surveil and curate data related to domestic violent extremism. Can you talk about that?
Yes, our grants have different guidance each year. This particular grant and the year previous has a very large focus on domestic terrorism and also terrorism outside of our area. And the state is responsible for meeting that particular piece of the puzzle. Am I echoing to you guys, or are you hearing me all right?
Hearing you just fine.
All righty, thank you. It's just bouncing back in my ears here. I'm sorry. So Idaho State Police has an organization within them that keeps an eye on those types of things. It's the Fusion Center. And those are funded through this grant, but not from us directly. Those monies come through the state and are funneled off the top to the Fusion Center to handle those types of things. Does that help any?
Mr. Chair?
Yes.
So the reason I bring that up is right now Congress is kind of investigating the Justice Department over this issue where they seem to indicate they're going to start investigating parents who testify at school board meetings for extremism, and now the Justice Department is sort of under fire for that because it looks like they may be targeting political opponents or people who are just engaging in their First Amendment rights. Is there any other language? I mean, I'm just kind of concerned about the open-ended language. Is there any parameters for investigation, or how is this going to be contained to areas that are appropriate?
I can't actually answer that particular question for you. I know our office is not involved in that type of investigative process. That's a law enforcement and not a emergency management function.
Do you have any other questions?
No, I don't have any other questions.
All right. I might add that this office works for the Board of County Commissioners. If we do have a question like that, we can bring it up and correct it. Do we have any other discussion on the grant? We have a motion.
Mr. Chair, I move to approve grant number 2113 AB is listed on the agenda and authorize the chair to sign the appropriate documents on behalf of the board. The grant is in the amount of $568,116.90. No match.
Is there a second to the motion?
Second.
You've heard the motion. All in favor, say aye. Aye.
Aye.
Aye.
Motion carries. Next up, we have weed and pest. We have a release of lien. Do we have a motion?
Yes, Mr. Chair, I move to approve one release of lien for weed and pest is listed on the agenda and authorize the chair to sign the documents on behalf of the board.
Second.
It's been moved and seconded. You've heard the motion. All in favor, say aye. Aye.
Aye.
Aye.
We have some interim agreements at Expo, Idaho. May I have a motion on the interim agreements?
I move to approve the 5 interim event agreements as listed on the agenda and authorize the chair to sign the documents on behalf of the board.
I'll second that, but only if Bob Batista agrees to dress up for number 3, the mass ball for creative anachronism. You gonna go as a knight or something?
Uh, well, he kind of stumped me on who I might go as, so. But it's going to be an interesting little event for sure.
I bet. So I second that.
Okay. You've heard the motion. All in favor, say aye. Aye.
Aye.
Aye.
Motion carries. We now have a number of agreements to discuss or to approve. I'll entertain a motion.
Mr. Chair, I move to approve the 11 agreements as listed on the agenda and authorize the chair to sign the appropriates on behalf of the board. The documents on behalf of the board.
Second.
You've heard the motion. Is there discussion? Hearing none, all in favor say aye. Aye.
Aye.
Aye.
Motion carries. Mr. Perkins is with us regarding bid 22002.
Yes, good morning, Mr. Chairman,
Good morning.
Commissioners.
Aye.
Before you this morning is the review of the bids received and award recommendation for the Public Works projects, 50,000 to 200,000. And that project is bid 22002, the Ada County Juvenile Services Staff Exercise Facility. And the evaluation team has reviewed the sole bid submitted for this project. And we have a letter with the evaluation team's recommendation for your consideration.
Okay, could you read the letter for the record?
I'd be happy to.
Thank you.
Letter dated November 2nd, 2021, to the Board of Ada County Commissioners from Ada County Procurement regarding bid 22002. Dear members of the board, after reviewing the sole bid submitted from First Call LLC, it was determined that their bid was over budget. Therefore, it is a recommendation of the evaluation group to reject the bid submitted for bid 22002 and discuss with the board options for this project.
Possibly just go out to open market.
That's kind of what it may be looking like at this time. We have an opportunity to talk with you on the heels of this meeting. So,
Okay, great.
Okay,
So our recommendation would be to reject the bid.
all right. May I have a motion?
Yeah, Mr. Chair, I move to reject the sole bid submitted for bid 22002, Ada County Juvenile Services Staff Exercise Facility, since it is over budget.
I'll second that.
Thank you. You've heard the motion. All in favor say aye. Aye.
Aye.
Aye.
Motion carries.
All right,
Thank you, Bob.
thanks, Commissioners.
Thank you.
Thanks, everybody.
Thanks, everybody. We're in recess. Good morning. Today is Tuesday, November the 2nd. The time is 9:30. The Board of Commissioners, sitting as a Board of Emergency Medical Services District, is in session to conduct its weekly open business meeting. With us, we have
Cameo Akins.
Cameo Akins, and we have
Sean Rain.
And Bob Perkins is here. Good. And we have Matt Reed here and IT guy. So, all three commissioners are present. Madam Clerk, are there changes to the agenda?
No, there are not.
No changes to the agenda. May I have a motion on the claims journal?
Yes, Mr. Chair, I move to authorize payment of claims as listed on the claims journal dated October 29th, 2021 regarding EMS expenditures.
Second.
It's been moved and seconded. All in favor say aye. Aye.
Aye.
Aye.
I'll entertain a motion on the minutes.
I move to approve the minutes as identified on the agenda and authorize the chair to sign the documents on behalf of the board.
Second that.
You've heard the motion. All in favor say aye. Aye.
Aye.
Aye.
We now have six agreements up for discussion. Do I have a motion?
Yes, Mr. Chair, I'll make the motion to go ahead and approve the 6 agreements as listed on the agenda and authorize the chair to sign the documents on behalf of the board.
I'll second that.
It's been moved and seconded to approve the agreements. All in favor say aye. Aye.
Aye.
Any discussion from you, Sean, before we approve these?
These are all renewals, Mr. Chair, Commissioner Kenyon, these are all renewals. The first 2 are for a blood draw contract with Garden City that we've had for years. The next one with Victory Medical is, they're a training site under our training center for the American Heart Association. The next one, ESO, is our chart writing software for the entire access system. Following that, we have a stationing agreement for the use of Boise Station 18, which actually belongs to North Ada County Fire and Rescue. It's that station on Chinden Boulevard, for us to put an ambulance in there. And the last one is with Stryker Medical. You guys remember our automatic gurneys. That's the service agreement for those. So
The one that kind of got away from us and my team.
Right.
I remember you guys trying to run interference too.
Well, we beat you. Okay.
Okay, aye. That's your third
All
aye.
right. Motion carries. Thank you, John. Now we have an update.
So, Mr. Chair, Commissioners, I've got Cameo Akins here and Bob also to talk about the rapid test kits. But before we get to that, I just want to report that our moving average continues to decrease. Yesterday it was just below 6 a day, so that's a good sign that we're moving in the right direction with COVID. Cameo, do you have an update on hospitals? I know that things are improving.
Yeah, so they do an IMOC call every day, determining how they're transitioning patients around the state. And both hospital systems here locally are seeing a reduction in their overfill. They've had to have overflow with their to be able to place patients here. They've seen a reduction at St. Luke's and St. Al's, so that is good. They're about 2 weeks behind us with what we see, so we are seeing that reduction, and we're hoping that will continue. They're still in crisis standards of care. However, they are starting to look at what those thresholds, if you will, of what that will look like to start to get the system out of that. They're still full, but the overflow of what they're doing is being reduced. So we are seeing a reduction.
Do the hospitals on those calls kind of report on just emotionally and mentally and physically where their staff are? I know that they've just gone through so much, and a lot like your folks, and they're just pretty exhausted. So I'm just concerned that even though we get out of crisis standards of care, that adrenaline rush of constantly being in the, saving people's, in that kind of mode, they're gonna just be exhausted and crash.
They do. They report on staffing. Staffing has been really hard, but as they're getting more people back themselves. We've seen it with our department as well, as people are not getting sick and we're not seeing as much people exposed. They're having better staffing, which means that people have more time off. So you can hear it in their voices. It doesn't sound as critical as it did, say, a few weeks ago. So you're starting to hear some relief.
Good, okay. Thank you for that.
I think that was kind of it on the COVID, kind of where we're at with COVID. Next,
Sean, before we
oh,
move
yeah.
on, Mr. Chair.
Yeah.
The Monoclonal Treatment Center, is that still being manned by the hospitals in their outpatient settings?
Mr. Chair, Commissioner Kenyon, the hospitals are still administering monoclonal antibodies. I know in speaking with Joe Lombardo last week, they were still the state was still trying to work with, a provider here that was outside of the hospital systems to be able to provide monoclonal antibodies, in a different setting. But so far, the hospitals are still providing that treatment.
In an outpatient setting?
Yeah.
Yeah, okay.
Yes, they call it an infusion center.
Infusion center.
At St. Luke's, I don't know what they call it, St.
And
Al's.
there are, I believe, 3 dialysis centers kind of throughout the Treasure Valley that are also doing the monoclonal antibody treatments.
Yeah.
I think that one of the issues was just communication between physicians of being aware of where these infusion centers were. And I think that over the past few weeks, some of that communication has improved. And I saw a story last week that was more of a national problem, not just a local problem, that nationally doctors weren't aware of where these treatment centers were. So we certainly weren't an isolated place for that.
Exactly. In fact, the director of Central District Health told me they'd sent out several advisories to the doctors, and they didn't know if it was getting through because some of these doctors' offices were still advising people if they if they tested positive, they were to drink lots of liquids and maybe take an ibuprofen, and not even let them know about the availability of monoclonal antibody treatment. And the data is clear. People that get a monoclonal antibody treatment don't go to the hospital as a rule. There's a few that do, but most don't. And you may notice that the report that Joe Lombardo has been doing now includes the amount of monoclonal antibody treatments that were handled in that week. Last week there was 200. They didn't even use all the product that they had available to them because there's still a limitation on the product. And all that tells me is there's not enough education getting out there.
Well, Mr. Chair, that was my next question is, I think this is one of those things where it kind of falls through the cracks on who the communication responsibility lies. The state isn't gonna do it for Ada County, right?
Right.
The hospitals haven't been doing it because they've been overwhelmed at their crisis standards of care. And the reason we wanted to put that in the third party is to help alleviate that. So would that be something that we should maybe be taking up and doing, or who should be getting that out?
Mr. Chair, Commissioner Kenyon, I really think Joe's approach of trying to work through Central District Health and get the message through them, because they have all the appropriate contacts for all the different physician groups and doctors, and and I'm not sure where the communication breakdown comes from that point, if it's just an email or if they need to send mailers, but I know Joe's been working with Russ Duke and really trying to get that.
Well, and they have sent out several health advisories, but I think they should probably continue and send and double up on it, because it actually, the monoclonal antibody treatment prevents hospitalization, clear as day.
Yeah.
And now there are still some that, and the critical thing about the monoclonal antibody treatment is it has to be administered within the first 7 days of infection. And so it's got to be caught early. From what I understand, the later it's treated, the less effective it is on preventing hospitalization.
Well, I'm just wondering, I think that that's true, just continue to go through CDH and MS and whatnot, but I also think that there needs to be better public awareness that if you have these symptoms, go in to see your doctor before 7 days so you can get referred for the treatment. And I don't think people understand that at all.
That's
And that's not out there, so
I agree. I don't think they
maybe
understand
when
it
we
at
talk
all.
to Elizabeth, we can have her do
And
something.
I don't think they are are aware, I think they're aware, but the availability, and that's one of the things you want to talk about, the availability of instant tests are slim in Ada County. You try to go out and find an instant test, it's hard. Now, they're there, but you have to really search, and I spoke to the pharmacist at one of the major national retailers, and they said, oh yeah, we have them here and charge $14, but we sell out within an hour when they get them. And it's because there's a lot of institutions that are now asking, you have to have a test before you can come into this event. And so people are, where do I get them? Where do I get them? And so it's and the Central District Health, they have a bunch of them, but they use their supply they send them out to schools for the staff and for the students. So anyway.
Okay, well, we can talk more and talk with our PIO and.
Well,
see if we can do
yeah,
something.
on information, but you have something to talk about instant tests?
Yes, Mr. Chair. So I sat down with Cameo, Bob Perkins, and Joe Lombardo to kind of walk through, what the availability of the tests were. And then, I brought Cameo in to kind of talk about how these tests could be used. Because I think that one of the important things to remember about rapid tests is it's really just a snapshot in time. So, when Cameo and Dina were down at the fair testing all of those folks every day, really all that told them was at that very moment they weren't COVID positive. And it gave us a good window so that the next day if they did test positive, we knew who they had been in contact with, so we knew who to isolate.
Everybody at the fair?
Yeah, well, that would have been kind of tough. At least Bob's staff. So I think that, the use of them becomes sort of difficult. I think if we looked at distributing them to different places for their use, we're looking at a lot of money that we would have to spend to be able to do that. Most of the physicians' offices do still have the availability of PCR tests. It takes a little bit longer, 24 to 48 hours to get the results back on that. But the efficacy, sensitivity, all of that is a little bit better on the PCR test than you get with the rapid tests. Rapid tests are still really good. Not saying they're not. But outside of that, Bob has prepared this document on what is available. And I'm certainly willing to read that in unless Bob would like to read it in. It would be my first time of saying all of Bob's credentials.
CPPOs.
Yeah.
I want to sit back here and listen to that.
So
You're gonna love it.
I can certainly read this into the record. If
Okay,
you
sure.
Okay. Date October 21st, 2021 to Steve Rutherford, COO, from Bob Perkins, Director, regarding COVID-19 rapid tests. Dear Steve, you wanted information on the cost and availability of COVID-19 rapid tests. I've collected information from 3 suppliers and have them listed below. I think it is probably apparent, but the supply chain is an absolute mess right now. Couple that with the fact that we are in competition with every private and public entity for the same COVID rapid tests. And the federal government is buying about $1 billion worth of COVID rapid tests from Abbott, the Buy Next Now, and various other suppliers. Makes for a very challenging supply environment. When ordering these kits, it is important to keep in mind that there is expiration dates on these tests. The test kits listed below expire in 12 months after manufacture, so if it is decided to be procured, that we be mindful of the expiration dates when ordering. Pure Vita GenBot is $10.55 per test kit if we buy in a pallet of 10,800 tests, coming up to $113,940. The estimated time of delivery is 1 week. Otherwise, it's $13 per test kit if we buy in smaller orders. The estimated delivery is 3 days. The next one from Cintas, the Abbott Buy Next Now test, is $31.50 per test kit. There are 2 tests per kit. We need to buy per case, which is 232 tests at $7,308 for a minimum order. The estimated time of delivery for this is 2 to 3 weeks. Then from Boundtree Medical, They have 3 different options, the Abbott Binax Now, Clarity, and Quidel QuickView. The Binax Now is $14 per test kit. The estimated time of delivery is 2 to 4 weeks. Then it's $10.76 per test kit for the Clarity COVID-19 rapid test. The estimated time of delivery is 2 to 4 weeks. Then $16 per test kit for the Quidel QuickView. Estimated time of delivery is 2 to 4 weeks. Sincerely, Bob Perkins, CPPO, CPPB, NIGP, CPP, Director, Ada County Procurement. My first time saying that.
So what's the proposed use for these for Ada County?
Well, and that's the big question. That's why I brought Cameo in, because I think that there's fairly limited use for Ada County to be able to do these outside of distributing them to people that could use them. And that's where we get into issues of expiration. You know, our own Binax Now test kits, many of them expire here in 5 days, about half of them. And then we have a month's worth that expire in December. So I think if we were to look at the use in Ada County to maybe supply our department, and then department heads have some test kits available so that we could test an employee if they were sick to say, are you COVID positive or not? I think there's some utility in that. I think outside of that, the use of them becomes more difficult, and I'd invite Cameo to speak about that.
Yeah, Mr. Chair, Commissioners, a couple of things that come to mind is, for example, if someone was able to stay at home, if they have symptoms, it's really difficult when you're in allergy, cold, flu, and COVID season. It's to navigate that. So if someone were able to stay at home, that would be the best thing for them to do. Some of the things that I brought up at a team lead meetings with Bethany and the team leads is if someone were needing to come in to do a presentation to the board or something like that, that would be a really good use of the test to be able to say in that moment, no, they do not have COVID, they're not shedding. That may not mean that they don't have it, but you would know right then that they're not shedding. They could wear a mask, they could come in and do their presentation and then go home. But as Chief Rain said, it is just a snapshot. That doesn't mean that 5 hours later they would not be shedding. The only way to really use these and have them work well is to use them every single day. That's just not a good use of the test, and that's the only way that you could say that someone does not have COVID is to use them daily. That's the way we use them at the fair, and we were able to find a couple positives while we were trying to keep that bubble of everybody safe, but people did get COVID from the fair, and then later on they were sick and had to follow CDC guidelines and all of that after the fair, but we were able to catch 3 during the fair, which prevented that our little silo that we were trying to keep safe. So it worked the way we set it up to, but it's just not the utility of using them all the time.
Feasible.
It's not feasible, and to be honest, for us to do it every day took 2 of us about 14 hours daily just to test the amount of people that we were doing.
Right. Isn't every test just a snapshot in time? So they're all just snapshots. We know that. And this is a snapshot of that particular day. And are they less? Do they test accurately most of the time, or is it better to have the saliva one that the drugstores are using? But then that takes 2 or 3 days because they have to ship it off to a lab for analysis. But again, that's just a snapshot in time as well.
Correct, Mr. Chair. So, but some of them are better. So not all of them are as accurate. So the PCR, the one that they send to the lab, will tell you definitively, yes, you have it. The ones that we have, they're about 95% accurate. And so even at the fair, we would say, yes, we think you have COVID, but we still sent those people to a doctor to get a PCR test to for sure say, yes, they did. But we were able to pull them away from anybody else. So we knew that they weren't shedding that day, and we could pull them out and then have them go get a definitive test, which the PCR tests are definitive. And then some of the other
Was any
ones.
of them test false positive?
No, they were all positive. The ones that we
So they
did
were
at the
So they were
fair.
actually accurate.
Yeah, and some of the other tests, unfortunately, though, are not as accurate. Some of the spit tests are not quite as accurate as the Binex Now ones that we are using. I don't know all of the percentages on all of the tests, but we did check into those when we got the Binex Now from CDH at the time.
Well, I think you've got to get a recommendation, because I have spoken to several of our elected officials and several department heads, and they think that it would be particularly, I talked to the prosecutor yesterday, and we don't know, we'd like to be able to have those available for our people, because they're out, seeing, talking to people, and of course so I think what you're suggesting would probably be a pretty good idea, to have at least a supply available for county staff and employees. I don't know about delivering to the public, but I do think it would be a wise use of county resources to make them available for our staffs, for our people who work for us and employees.
How do you administer those tests?
It's pretty simple. There's just a little card, you open it up, and there's a reagent, a little bottle of reagent. You put 6 drops on this one window, swab each nostril 5 times, put the swab in, turn it 3 times, close it up, and then watch the results come in. You can see the reagent go up the test strip. And, in my experience, when we have a positive, it's an immediate. You see it very quickly. We've had a few results that took 12 to 13 minutes. You have to wait a full 15 minutes to verify that you've got a negative test. But then you have a control line that you need to make sure shows up. And if you have a control line and nothing else, it's a negative. If you have a control line and a line at the sample, then it's a positive. So pretty easy to use. And morning, Joe. Pretty easy to use, and we could certainly cameo and Dina Hardaway. She's our infection control officer, which is not just for COVID. That person keeps us safe, because we get exposed to hepatitis and HIV, all kinds of things. But they are very well educated on how to administer the test, so we could certainly set up a training with the people the department heads identify as the testers.
So you don't self-administer those?
You can.
You can. They're the exact same test. If you go to Walgreens and buy the Binax Now kit, which I think Joe has done, you buy it off the shelf and it has instructions. So it's pretty simple to use.
Yeah, Mr. Chair and Commissioners, I've been working closely with Bethany and the HR as well, so we could come up with a good algorithm of what that would look like and when it would be appropriate for them to take it, so they could do a presentation for the court, stuff like that, because there is appropriate times to use those,
Sure.
so that we could keep continuity of business going for the departments.
And then you can, Mr. Chair,
Yeah.
also recommend which one we want to, and have the quantity and product.
Yeah, Mr. Chair, Cameo and I, all of our experiences with the Binax Now kit, and it's an Abbott product, which Dr. Hilvers at the Emergency Responders Health Clinic is using not only the Binax Now test kit, but he's also using the Abbott, it's the PCR version of
Correct.
the test. That's a rapid result, though. It's still, I think, a 15 or 20-minute result that you get on that. So my recommendation would be to stick with Abbott, because we have experience with that. We know the specificity and sensitivity are very good with that particular test, so that would be my recommendation. Would you agree, Kenya?
I would agree.
Okay.
Well, I think it'd be a good idea if you do come up with metrics and an amount and so forth, and then get back with us, so we can set it up to where at least our employees, anybody who works for the county or associates with the county, if they need a test, they can get a test. And they don't have to be calling all around the valley to find out.
Well, like you said, for continuity
Yeah.
of, county
Yes.
business, it's
Yeah.
important that if it's
Yeah.
available, we have that on hand.
Yeah, so if you can do that,
Thank
I
you.
Yes.
appreciate that.
I can do that.
Welcome to our meeting, Joe.
Thank you, Mr. Chair.
All right, well, thank you.
Thank you.
Thanks, Cameo, good to see you.
Thank you, good to see you.
Cameo. We spoke about you today.
Okay.
You have included in your report, your high level report, the amount of monoclonal antibody treatments that were given each week.
Sir.
And last week was 200, and there's actually product left over from what the allocation was.
If I understand correctly, yes.
Yeah, and so we want to try to figure out a way to use at least the allocation and get that up some way. Maybe some sort of communication strategy. Anyway,
Makes sense.
all right. Do you have anything you'd like to share with us while you're here?
As a rule of thumb, I agree with everything Cameo says. I think we're good.
It's a good rule of thumb.
Well, that's a good rule of thumb. All right, well, thank you. We'll be in recess.
All right,
Thank you.
Thank you.
Thanks.